not overcrowding. Well, most people haven't mastered the at-home haircut, which is why many are thankful salons are open again.
Trying to keep everything disinfected.
A lot has changed at Allure Styles in Lawrenceburg. Stylists are no longer taking walk-up customers. Masks, of course, are essential, and everyone wears a clean cape. Still, it's a relief for many customers to be back in their stylish chair.
While I don't have a lot to work with on top, I've tried to compensate here during the coronavirus with my quarantine beard.
And things are much different also at malls these days. At the Kenwood Town Center, for example, there are frequent cleanings, hand sanitizing stations, and social distancing directions. Many shoppers are coming to prepared as well.
Oh, yeah, we got our masks, our gloves, we've got the wipes in the car, so we got our sanitizer, we're ready to go.
It's up to each individual store whether you can try on clothes, and actually not all stores are even open. At Kenwood, Nordstrom, Macy's, and the Apple Store are all closed for the time being. So here's everything that's opening within the next couple of weeks in Ohio. Next week, it's campgrounds and horse racing tracks. The 31st, daycares and day camps. And the big one is May 26th. Pools, B&Bs, low-contact sports, and gyms will be good to go. But the last 2 months have changed the traditional gym model.
There is a big fear factor, some people coming back, and I just think it's going to take time. We're going to be doing, some clients inside, maybe some in the park, some virtual training at first. So it's going to be like spread out.
And equipment will be spaced out and cleaned after each use. And at many gyms, clients will have their temperatures taken. But state leaders warn this is not a free-for-all opening, and that the key to stopping the spread of the coronavirus is you.
So I beg of Ohioans, really help support these actions, help support these businesses to succeed by going about these things very, very carefully, thoughtfully, with this.
And all that brings us to this week's front page centerpiece. Cincinnati's hospitals are open for business, but whether they can recover is another question. Medical centers have lost billions because of bans on lucrative elective procedures. So it's not a stretch to say that as doctors and nurses struggle to care for patients and this crisis, some hospitals are facing the fight of their lives. Courier reporter Barrett Brunsman wrote this story, and he talked to Courier editor Rob Dahlmeyer about how hospitals are trying to get that revenue back.
Barrett, thank you so much for being here. We're both safely ensconced in our homes. But you had a big cover story this week, on Cincinnati's big hospital systems and how they're faring. First things first, how serious is this pandemic for our big systems?
Rob, some local hospitals have lost $10 million or more a week during the ban on elective surgery. And that could translate into losses in excess of $100 million for the fourth quarter of their fiscal years. So it's very significant.
How do they offset those losses?
In some cases, with pay cuts for executives and reduced hours for others. Some hospitals have furloughed workers. Other ways include eliminating consultants and holding off on some capital projects.
And how can hospitals recover? And maybe you can be a little bit more specific here while we're talking about this. When you're talking about recovery, what did some of the CEOs of these local hospital systems tell you about what they need to do to recover? Again, specifically.
Yeah, well, they're all optimistic that the situation will get better. I can tell you that St. Elizabeth Healthcare, which is the dominant medical provider in Northern Kentucky, was allowed to resume elective procedures this week at 50% of the pre-COVID patient volume. That's true of all Kentucky hospitals. And Sani will be able to ramp up to 100% toward the end of this month. And the CEO, Garen Colvin, tells me that St. Elizabeth will go to 7-day-a-week surgeries to make up for lost revenue. Ohio hospitals also were allowed to resume some elective procedures at the beginning of this month.
Now, that's something that's interesting is that, and you did a great job of explaining this in the story, but when the COVID-19 crisis started, the hospitals obviously were in the news because they were, we were hoping that they wouldn't be overloaded with patients. And so that's what everybody focused on. But the revenue that hospitals need to generate to stay open, those kinds of things just weren't happening. And how are they facing that now? Are people willing to go back to hospitals? And what were the messages that the CEOs told you about how safe it is to go to a hospital?
Yeah, the local hospital systems are actually coordinating on their message on this, Rob. The local CEOs stress that the hospitals are expert at containing infectious disease and at preventing its spread. And each of the hospital systems has taken extraordinary measures to segregate COVID patients from others at their facilities. For example, St. Elizabeth treats COVID patients only at its Fort Thomas campus, and their surgeries are done at St. E's, Edgewood, and Florence hospitals. Also, all patients, employees, vendors, anyone else is being screened at the entrances of the hospitals. They're taking their temperature, and everybody inside is required to wear a mask. Not only all the employees, but even the patients who are undergoing surgery. And the CEOs tell me, Rob, these measures are likely to stick around.
Yeah, well, they are, loud and clear in your story was that they are open for business and that they're prepared for this. Obviously, they've been delivering babies for the last couple months, and that's gone just fine. So if people out there have been putting off, surgeries, that I guess the message is, come on back, and this is what the hospitals need to keep rolling. So thank you very, very much, Barrett, for being here. And everybody should read that story. It's a really good one. And Barrett got access to pretty much all the CEOs of our big systems. It's a great read, and it's well worth your time. Thanks very much.